On-the-scene coverage of AHA 13 is supported by Janssen Pharmaceuticals Incorporated.
There is an unmet need here. There's this growing population of patients who have signs and symptoms of heart failure yet preserved ejection fraction. We did not achieve a reduction in our primary endpoint. So that's, for the purists, that's the message. We did not. But we have to take care of these patients. So one has to dissect a trial. When you dissect a trial, you're on thinner ice. When you dissect our trial, I think a pretty firm spot is that we did reduce hospitalizations for heart failure with a generically available medication, spironolactone. If a physician chooses to use that, we also show how it can be safely done by monitoring potassium and creatinine and using a low dose. So trials are to inform physicians. And it's really for the audience to decide when they look at our data, is there enough here to help them reduce the morbidity of these patients with preserved systolic function heart failure? I think they'll look carefully at our data, and many will adopt that as an approach. And others will say, not enough for me, and I would understand both sides.
If the patient has another indication for a mineralocorticoid receptor antagonist, hypertension, coronary disease, definitely that specific HFpEF patient should definitely be treated with spironolactone. I would be tempted to take high-risk patients with very high BNP, lots of comorbidities that would suggest high oxidative stress, and treat them, but the evidence is not really there, so I still think we need more studies. We know that with any time we use this drug, you've got to monitor the patients very carefully, and if you don't have the disease management system to do that, then you shouldn't use it, or you can cause more harm than good. But heart failure clinics use spironolactone all the time, and they monitor their patients very carefully. Patients have to be compliant with that monitoring. So yes, it's a concern, but it shouldn't impede the use of it in the right clinical setting.